now we will discuss about the management. Fine. We discussed that there is a problem in the dopamine. A low dopamine hypothesis theory is basically a valid in the case of ADHD. Remember, along with the dopamine, there is also, you can say, less availability, or there is a poor availability of one another neurotransmitter, and that is called as a norepinephrine. Okay, norepinephrine, fine. So norepinephrine is also poorly secreted by those neurons which is basically managing the attention, because for maintaining the attention we need to narrow down our senses. Okay, narrow down our senses means we need a less sounds from the surrounding, we need less visual field. We want to narrow down the visual field, we want to narrow down, you can say, the auditory field. Fine. Visual field and auditory field, this is done by the what? This is done by the dopamine. Got it? But we need the alertness also. No, we need alertness also, and that alertness is, you can say, contributed by the norepinephrine. Fine. Then we have the proper attention, a proper focus, a proper concentration on the task. Okay, so here along with the dopamine we have the less availability of the norepinephrine too. No problem. Now coming to the management. In the management we have the two options. Okay, we have the two options. The one is to manage by the pharmacological agents. Okay, psychopharmacology basically agent, and another one is a psychotherapy. So psychopharmacological agent as well as the psychotherapy, these both the options are available, and most of the time both the things is, you can say, combinedly used to manage the ADHD condition. Fine. But if you're talking about the first line of treatment, then first line of treatment goes with the psychopharmacological agents. Fine. Now this psychopharmacological agent is called as the stimulants. They are called as the stimulants. They basically stimulate those neurons which is you can say associated with the dopamine secretion, basically the dopaminergic neurons. Fine. So the dopaminergic neurons is stimulated by this agent. Fine. So one of the agent is called as the methylphenidine. Okay, I'm not pronouncing it correct. It is methylphenidate. Okay, methylphenidate based stimulant. Another we have is the amphetamines based drugs. We have the two kind of stimulant. The one is the methylphenidate, another one is the amphetamines. What things they are doing? They are doing? They are doing two things. First one is they stimulating those neurons. Okay, they stimulating basically those neurons which is involved in the secretion of dopamine. Fine. And also they are inhibiting the reuptake mechanism of dopamine. You know that in the what is happening, suppose this is one neuron, okay, and there will be the another neuron. Suppose this is a neuronal end of another neuron. This is called as the presynaptic membrane. This is called as the postsynaptic membrane. Here it is the dopamine. You can say neurotransmitter is released. Once the neurotransmitter will work on the postsynaptic membrane, then whatever left neurotransmitter there is reuptake by the presynaptic membrane. Are you getting my point? So these stimulants, certain stimulants, they will, you can say, inhibit this reuptake mechanism, so that most of the time the neurotransmitter will available in this synaptic cleft area, and person have, you can say, the person's neurons have the, you can say, prolonged time availability of those dopamine, a neurotransmitter. Are you getting my points? Suppose this is a two neuron, okay, and this space is called as the synaptic gap or synaptic cleft. Fine. So this neuron will secrete this dopamine hormone. Okay, now in this is the another neuron. This neurotransmitter will be received by this neuron called as the postsynaptic neuron. Fine. So whatever, and it need you can say not one time all amount of neurotransmitter, all amount of dopamine. It need a certain you can say the dopamine. So these dopamines will be, you can say, secreted by this presynaptic membrane. There will be a synaptic fusion and all the processes, and this comes in the synaptic space. Okay, now this neurotransmitter, they will bind over the postsynaptic neurons, and this postsynaptic neuron have the impulses, okay, have the command. Now then whatever the neurotransmitter is left over here, that is reuptake by the presynaptic membrane again, okay, by breaking the neurotransmitter by the certain enzymes. So there will the first problem is these neurons will secrete a very less dopamine, so there is a very poor dopamine is available here first of all, and this is also a reuptake. Then there will be a very you can say the less availability of the dopamine for my postsynaptic neuron. So the one of ways is, why not you can say stop this reuptake mechanism, so that there will be a most of the time the dopamine will be available and for my postsynaptic neuron. Fine. So these stimulants, they are not only stimulate the dopaminergic neuron or you can say the adrenaline neurons, they are also you can say inhibit the reuptake mechanism. Fine. The amphetamines, they are involved in the release of basically the adrenaline. Okay, they are associated with release of adrenaline. Fine. So they stimulate the adrenaline, and there are so many name of the drugs. Okay, amphetamines, methadone based, there are so many drugs. Now coming to the psychotherapy. So in the psychotherapy, basically a clinical psychologist or psychiatrist, they try to establish, you can say, the normal behavior, the normal societal behavior in the ADHD children, ADHD patient or adult, okay, by giving the multiple types of psychotherapy, okay, called as the CBT. Fine. Cognitive based psychotherapy. There are other form of psychotherapy called as the cognitive behavioral therapy, CBT. Then they have the parents training as well. Then they have the social skill testing, and also the behavioral therapies. So these are the certain common psychotherapy. But remember, the first line of treatment is the stimulants, okay, the psychopharmacological agent. And yeah, of course, the chemical drugs do have the side effect. And here also the most common side effect is the insomnia, difficulty in getting the sleep. Okay, apart from that, person have you can say the problem in their appetite. They have a loss of appetite, vomiting, and the insomnia, difficulty to getting in the sleep. These are the certain, you can say, the side effect related with this methylphenidate and amphetamine. These side effects are more, you can say, common in the amphetamines, less common in the methylphenidate. The one meta-analysis, this is that the first line of treatment, if we choose the drug, then it is the methylphenidate. Now we have another class of you can say the drug that is not a stimulant, they are a non-stimulant, and that is called as the atomoxetine. This is also commonly used to manage the attention deficit hyperactivity disorder. One thing I missed to forget to discuss is the types. So types are basically, we discussed the inattentive and hyperactive. These are basically the two types. There are three types according to DSM-4. Okay, there are three types. The one is the inattentive, okay, predominantly inattentive type, where basically the attention is not there, problem related with the attention. Another we have is basically the predominantly hyperactivity or impulsivity, problem related with their activity, like the forget the things, fizzing, internal motor is always going on. Are you getting my points? Climbing on things, jumping on things, smashing all the things, being loud, talk excessive, okay, not allow the other person to talk, difficult to waiting for their turn. So these are the hyper activity problem, hyper impulsive as well as the activity problem. That's another category. Then we have the another category that is both the you can say the dominant impulsive or hyperactive behavior along with the inattentive behavior. Both the present, that is called as the combined type. Basically, we have the three type of the attention deficit hyperactivity disorder. So I hope you get the good insight about the ADHD from our today's lecture. So thank you with having me. Bye. Have a nice day. And if you like these videos, then do subscribe our channel and also see some of the good podcasts are available. The lecture series are available on our channel, Clinical Care Insights. Okay. So thank you with having me. Bye. Have a nice day.